For my practice, what it allows me to do is to have one versatile tool that I can use for a multitude of procedures, a multitude of treatments, a multitude of options. I don't have to buy a different piece of equipment for every little procedure that I want to do. It is an outstanding tool in terms of cutting, an outstanding tool in terms of coagulating or producing any volume reduction of tissue for submucosal or subcutaneous coagulation. And it just adds to my practice a significant amount of flexibility at a very reasonable price. I don't use a scalpel anymore. So the first thing that's different is I use my Elman for every incision that I make. And in doing so, I don't have any near the amount of bleeding that you do with cold steel scalpel. So I use it on all skin incisions, I use it on all mucosal incisions, I use it on all intranasal work that I do. So from an incisional standpoint, it now takes away the need for a scalpel. For some of the procedures that I do for snoring, it takes away the need for some of the very expensive procedures that we used to do. I used to have a CO2 sharpening laser. Excellent tool for doing palatal work. But I can get the equivalent result with what seems to be less pain associated with using high-frequency radio waves as opposed to the CO2 laser. Don't skip any of the steps. Learn how to use this technology little by little and add one piece of it to your armamentarium every period that you're going to look at doing another procedure. Start off with a very simple piece of chicken breast. Use your probes. Learn how coagulation works on chicken breast. Learn how it cuts the chicken breast. Get an idea of how much power and how much energy it takes to coagulate chicken breast. You will have a whole different appreciation for what this technology can do for you if you do it on inert chicken breast before you do it on live tissue. Then, once you're comfortable with the dead chicken, then go ahead, schedule your first case with your first patient. If you get a lot of electrical energy while you're doing the case, you're giving too much power to your incision. If as you're pulling your probe across the tissue, it's dragging and tearing tissue, you're not giving enough energy to the tissue. You'll begin to get a feeling for how much power works best for your particular application. The amount of power is based upon several variables. It's based upon the amount of contact area, it's based upon the duration of time of that contact, and it's based upon the frequency of the particular source that you're using. In this case, the frequency is always going to be the same because your radio frequency generator is always going to have the same output. However, the amount of time that it takes for you to make the incision and the amount of surface contact area that you're going to have, depending on how you use your instrument, is going to vary. So you don't want to necessarily stick to whatever power settings you think is the right power setting based upon something you read. You want to gain a little bit of experience with each case, and then your learning curve is going to grow with each and every case that you do, and each and every different procedure you add to your armamentarium. Probably the first procedures to start with are the simple excisional procedures. Excision of skin lesions, excision of an oral lesion, something where you would just simply use a scalpel so you can get a feeling for how much more flexible and versatile this particular tool will be in your hands. Once you're comfortable with that, then I think the next stage would be go to some of the reduction procedures, like a turbinate reduction or a palate reduction procedure. So each step, take it one step at a time, get a feeling for how the tool works, and then don't necessarily marry the one tool. You can also combine it with other tools. So for example, I like to do a lot of sinus work. I will use this as part of my sinus work, but I will not use it exclusively for my sinus work. Like any other operation, we all have our favorite instrument. I had a partner who could do any operation in the world with a Kelly clamp, at least so he claimed. So yes, pick one or two probes to start with. Make those the ones you're comfortable with. My favorite single one is the Empire needle. It's It's the same as the Colorado tip. Has a very sharp point, tungsten tip. I use it for almost every incision I make. It's the one that I'm the most comfortable with. I know that some of my colleague in oculoplastic surgery, the reputable Dr. Older, prefers a different tip. He likes a thin wire tip for his blepharoplasty incisions. It's his favorite tip. Each one of us gets to choose their own favorite tip. First of all, when you look at the histology of the incisions made with scalpel versus Elman 4 megahertz radiofrequency wave, you have less lateral destruction of tissue with the Elman than you do with the CO2 laser, either on super pulse or on intermittent pulse. You have it less than neodymium YAG laser, less than the argon laser. So from a utilitarian, from making the best incision with the least lateral heat and the least lateral damage, this is the ideal instrument to be used. The second is because it's such a precise incision, you can much more flexibly get around tissue. We did a clinical demonstration of that today, and working around some circular tissue in some very difficult parts of the anatomy, we're easily able to sculpt out some of these growths that would be very difficult to get an equal result with a sharp scalpel, no matter what scalpel we were to use. The third is that while you're doing all this kind of work, you're coagulating the tissue at the same time that you're cutting it without creating the lateral heat damage. So you have better control, less lateral heat, less scarring, better coagulation.